Let us talk about HbA1c, which you might know as 3 महीने वाला hemoglobin or just A1c. We all know that this test is done for diabetics mellitus, and as per American Diabetic Association, the normal levels are less than 5.7%. If they are between 5.7 and 6.5%, that means you are at risk of developing diabetes, you are a pre-diabetic, and hence lifestyle modifications are very important. If the levels are more than 6.5%, that means you are a diabetic and you need to consult your doctor as soon as possible and start appropriate treatment. Also, HbA1c is great predictor of complications of diabetes, mainly the microvascular ones, which includes neuropathy, that is nerve damage, in which patient experiences tingling or numbness, usually in lower limbs, and muscle weakness. Second is retinopathy, that is vision loss or blindness, and third is nephropathy, that is kidney damage. HbA1c is way better than other available tests. For reason number one, it measures the average blood glucose for past 3 months. That means you cannot fool your doctor by changing your diet a day or two before giving blood sample. Also, it is not affected by exercise. That means if you're walking to your lab to give samples, your blood glucose may be altered, but HbA1c won't be altered. Reason number three, that you don't need fasting to give samples for HbA1c. To understand the reason behind all these advantages, we need to dive a little into biochemistry. HbA1c is also called as glycated hemoglobin, glycosylated hemoglobin, or glycohemoglobin. So what happens? When there is high blood glucose, it binds non-enzymatically to beta chain of hemoglobin, to be more specific, to valine residues at N terminal of this chain. Now this binding of glucose and beta chain is irreversible, hence they remain together till the lifespan of RBC, that is 120 days, and hence it gives an average of 3 months and also not affected by any factors that I mentioned before. Disadvantage of this test is it cannot be used in patients with hemoglobin or RBC abnormalities. If you experience any of these symptoms, you need to get your HbA1c checked. I have a question for you. Can you tell me which colored vacuum container is used to collect blood for HbA1c?